We have three different forms of stress. We have physical stress, emotional stress, and chemical stress. Emotional stress could be good stressors such as a wedding. Definitely stressful, yes. New baby, a new house. But there's other stressors that are not so great, like deadlines. Sometimes stressful jobs, being a student and having finals, and finances, relationships. Those definitely can take a toll on the body. Chemical stressors would be anything that we ingest and we put in our mouth, or anything that comes into contact with our body, as well as the pollution in the air, as well as anything that comes into contact with us. Today, we're going to really delve into physical stress. So when we talk about physical stress, we're talking about the musculoskeletal system. The musculoskeletal system is basically your muscles and your bones, and they house your nerves, basically. So your musculoskeletal system can really have an effect on the nerves and therefore the functions of your body. So it's really important that we maintain good musculoskeletal system function so that we can have nervous system function that's great as well. Now, we have 24 vertebrae in our spine, and they have a tendency to twist and rotate. They're supposed to, because just like we have joints in our fingers for motion, we have joints in the spine for motion, and we call those facets. And those facets have cartilage and have synovial fluid that allow the joints to move in various ways. So they can move forward and back, they can move down and up, and then they can rotate side to side. That's what allows the blood flow and the oxygen and the nourishment to reach all the soft tissue, ligaments, the tendons, the joints, the nerves, as well as the discs. So because the discs are made out of 80% water and 20% cartilage, they actually fulfill two different functions. One would be shock absorption, and the other would be that they act as a spacer, so that nerve can come out of that spinal cord and go to different parts of your body, your lungs, your kidneys, your liver, your digestive system, your legs, your feet, your ligaments, tendons, everywhere. And the nerves control all functions of the body through these nerves that travel between the spinal bones. Now, if we have, did you know that you lose a 1/4 inch of your height by the end of the day, every day? Because of gravity's compressive forces, as you're sitting, standing, and walking, the discs, because they're made out of 80% water, they lose water throughout the day. And so when you lay down, well, at the end of the day, you lose a 1/4 inch, sometimes even 1/2 inch. When you lay down, the discs regain water and they maintain their height again. So that's good. So you would be tallest in the morning. But let's say if we have a vertebral misalignment. We call this a subluxation. You can call it a misalignment. It's basically a spinal bone that's shifted out of alignment. Now, this can be caused by one of those physical stressors that we just talked about. Now, nonetheless, when you lay down at night, normally the discs would regain water and maintain their height because you can see there's motion. But if you have a misalignment of a spinal bone, that disc is not going to absorb water as efficiently. So over time, the disc is going to dehydrate and degenerate, because when there's no motion, the disc is not able to expand and absorb the water. So the disc starts to dehydrate and then go into next phase where the disc is losing some of the height. And what happens when the disc loses height? We lose the space in which the nerve comes out from. And then you leave that without correcting it. What's going to happen? Well, the body's going to try to self-correct by depositing bone spurs and calcium to anchor to the one above and the one below to essentially fuse the bones together. We call this bone remodeling. People always ask me, why do we get bone spurs? Well, wherever the body has or feels stress, the body's going to deposit calcium, forming bone spurs to kind of stabilize, to anchor, and to fuse. And so just like it would a broken bone, so if you have a broken bone, your body naturally wants to mend it together by depositing calcium and collagen and all the healing properties that we have to essentially fix and repair that broken bone. Now, when we're at the third stage of degeneration, you can see that there's hardly any disc remaining. The disc is completely degenerated and the nerve is getting atrophied. You can see how supple and strong this nerve is, right? And then you see how atrophied and degenerated this nerve is. So over the years, the disc has not been able to fulfill its function, and therefore having a nerve that's pinched like this for so long, you think it gives you symptoms of pain, but 90% of the time you actually don't get pain. Maybe in the beginning when it was first happening, but most people take some ibuprofen to decrease inflammation, and then the body stops giving it signals, and then meanwhile the body's trying to repair itself by fusion. So most people will have loss of function long before they actually have symptoms of pain. So a frozen shoulder or indigestion or heartburn or constipation, those are all various dysfunctions, which means that the nerves were not able to communicate well with those organs. So it's not really a good practice to wait for pain, because pain is not a good indicator. The problem is there long before you actually start to have symptoms. Symptoms such as tightness or restriction or lack of motion, that also is an indication that there's some dysfunction and improper motion of the musculoskeletal system, which houses the nerves. So if the muscles in the structural system, it doesn't have good integrity and it's really weak because it's so tight and rigid, then the nerves are not going to function well, and you start to have dysfunction. Now this is a picture of a nerve. This is a nerve, and this is the blanket around it. We call that the myelin sheath. It's actually made out of cholesterol as well as fatty acids and protein. So you see the blood vessels that nourish this nerve and the myelin sheath so that it can transmit signals very, very quickly. When we start to lose that blood vessels and you start to see less of the blood vessels because of compression, then the myelin sheath is not getting the nourishment that it needs to sustain that nerve. And so therefore the nerve starts to atrophy. And then when it gets to this point, obviously that's irreversible, and the nerves are not able to transmit signals at the rate that they should, so that our body and our organs can receive the messages from the brain so that they can function well without resorting to medication, but naturally having a normal function. And a lot of it starts with the posture. The posture is huge. And most people don't realize that when we have these curves give us leverage, which is strength, balance, and stability. It keeps the muscles pliable and the soft tissue pliable, allowing not only blood flow and nourishment to all the soft tissue and the joints and the nerves, but also when the muscles and the soft tissue get really, really tight, they pull the bones out of alignment, compressing the nerve that controls these specific areas, and as a result cause these dysfunctions. And if you look here, I don't know if you can see, but a lot of these things are not just pain related. You know, there's constipation, there's irritable bowel, there's asthma, there's dizziness. There's so many different functions related to the root cause, and that's usually in the spine. So looking at these x-rays are all from the in the neck, middle back, and lower back. Textbook normal, and this is phase 1, and this is phase 2 and phase 3. Now when you compare textbook normal to phase 1, phase 1 is straight while textbook normal is nicely curved, and you can see the disc spaces and you can see the nerve spaces. This is a viable, healthy spine where it's getting nourishment to the discs and to the nerves. So now when the spinal bones shift and everything is so much more straight and stiff, there's lack of blood flow, and then there's more calcium deposition, and you barely can see the joint spaces. And so what happens is from here, we can actually still correct it with appropriate care. So we do that with physical therapy. We do that with stretching, exercise to create flexibility. We address it with trigger point injections, sometimes if it's warranted, as well as chiropractic adjustments, and just overall improving posture and improving range of motion. And pain goes away as a side effect, because if you improve function and range of motion and improve your posture, you don't actually feel pain, but you do have improved function, breathing, posture so much better, you're oxygenating your lungs so much better in your body. So when it's at this point, we can actually still correct it at phase 1. But if we wait and don't correct it, then the next phase is phase 2, where there's degeneration and loss of disc space. And the reason there's loss because there's minimal blood flow. And so the body's naturally trying to fuse this just like it would a broken bone. So that's the body's healing property, but we don't like that because that's what's going to damage the nerve and create dysfunction and disease. So when it's at this point, the only thing we can do is actually stop it from getting to phase 3. When it gets to phase 3, then at that point, obviously, it is not correctable. Even here, it's not correctable because there's already degeneration, but we can still create motion and build a curvature and not allow it to get to phase 3. As you can see where the bones are growing together and there's like fusion and bone spurs. So this, we do have patients that come into this phase, and you wouldn't believe it, but a majority of the time they don't even have pain. They have loss of function. They have taken out their thyroid, or they have a frozen shoulder, or they have carpal tunnel, and they've had numerous surgeries. So it doesn't look good in this phase, but we do have patients who come into that phase so that we can do something for them. Now, this is a good amount of explanation and education so that you can see what phase of degeneration you're in and what can be done to correct it. And any other questions you may have, we can address.